I want to talk about our smart cap to track medication adherence. So it's similar to our bottle, smart bottle. The difference is that let's say you have a generic bottle that's labeled, you've already done stability testing, and you can't take your product out and put it into another container. The smart cap works very similar. It sits right on top of the cap, and there's a fastener here. There's a little ring that just kind of keeps the cap together all in one piece. So every time a patient were to open and close the cap, it sends a data signal over the cellular network to our software, our secure database, down to the second when they took off and put back the cap. So the way it works is, let's say your dose time is at 1 o'clock. At 12, it'll start to make a glow to slowly nudge the patient to take their medication. If at 1 they miss their dose, it'll make an alarm. So this has a sound, it'll make a chime, and it'll also send the patient a text message. And if they have a caregiver, send the caregiver a text message reminding them to take their medication on time. What we see in the data every time is that patients will start to first take their doses sporadically, miss doses, and then over a period of a couple of weeks, we start to see them start to take their medication either right at the dose time or right before consistently. And in the data, we see uplifts of 22% versus control. Phase 2 data is where all of the adherence data was over 90%. It works really well in the clinical trial setting when you want the patient burden to be as low or zero as possible, but also not only track medication adherence, but improve it and change patient behavior. And that's exactly what this has been made to do.